Gum disease and how to keep it away from your family. Many people have the occasional experience of bleeding gums. If not understood, this critical symptom may cause anxiety and unnecessary fear of periodontal disease or gum disease. Although bleeding from the gums could be an important sign of a potential problem, it's not always a sure sign of disease. One of the more common causes of bleeding gums is the use of a wrong toothbrush. People whose gums bleed because their toothbrush is too coarse for their gums and mouth will not feel pain, but they will see bloodstains when they spit out their toothpaste. This is especially true if you've just started to use a new toothbrush. However, if you suddenly start to see bloodstains in your spewed toothpaste, even when you have not recently changed your toothbrush, here's what you need to know about gum disease. Gum disease is an infection in the gums. The most common reason for developing gum disease is poor dental habits over prolonged time. Regular brushing and flossing are some of the routine habits that are good for every household. Regular brushing and flossing are some of the routine habits that are good for every household. However, in some instances, even when members of a household brush and floss regularly, one member of the family may develop gum disease. Typical symptoms of periodontal disease include bleeding from the gums, inflamed or swollen gums, and sensitivity or pain when brushing the teeth. A person with gum disease will definitely find bloodstains when they spit out their toothpaste. When a person with gum disease looks into the mirror after eating or brushing, they may see a thin trail of blood flowing from their teeth. Though it's not a life-threatening emergency, it is important that a person bleeding from the gums visit dental hygienists or a DDS, doctor of dental surgery, as soon as practically possible. How does gum disease happen in a household that brushes regularly? Well, one of the most common trends in our modern world is to be in a rush to complete every routine activity. Therefore, many people don't pay much attention to making sure that each tooth in the mouth is thoroughly clean before ending their routine brushing session. The other habit that we tend to slack on is making sure that everyone in the household brushes their teeth at least twice a day and flosses at least once a day. Many of us think of brushing as a hygiene habit that ensures we're attractive when we interact with people during the day, but are slack in brushing the teeth at night before we go to bed. Rushed toothbrushing and sleeping daily with a mouth full of leftover food particles are ideal situations to create a healthy environment for bacteria causing toothache, infections, cavities, and gum disease to thrive in the mouth. Quick tips to keep dangerous bacteria away from your household. Ensure everyone brushes his or her teeth daily and thoroughly before going to bed at night. Bacteria and germs multiply the most during the night, and this is the most important time to have a fresh mouth. Designate a toothbrush for each member of the family. No one should share a toothbrush, not even with a beloved spouse. Assign a dry place to store toothbrushes. Toothbrushes should be stored in an open area where they can drip dry. The best place to store toothbrushes is outside of the area where you have a flushing toilet. Added bacteria in the air from a flushing toilet will find their way to the toothbrush, increasing the potential of disease.